Welcome to the Wellnest Mamas podcast. We are committed to leading a sustainable lifestyle and making community connections. In a world where stress and chaos seem to be the norm, finding balance and fostering a sense of true well-being is essential.
Whether you are just beginning your holistic wellness journey or are already deeply dedicated to the practice, this podcast is for you. Join the Wellnest Mamas as we uncover the secrets to holistic wellness and discover the power of building a healthy community that supports and uplifts one another.
Sit back, relax, and get ready to embark on a transformative journey to leading a sustainably healthy lifestyle. We're glad you're here.
Welcome back, everybody. This is Steph, and we are here with Wellnest Mamas podcast.
Hi, guys. I'm Caitlin.
Hi, I'm Claire.
This is Dr. Claire Stone.
Thank you. I appreciate the formality, but I usually just go by Claire.
Awesome. So tell us about what you do.
Yeah, so as Caitlin mentioned, I am technically a doctor of physical therapy. So that's different than like your medical licensed physician. But that is what my license is under, is I'm a licensed physical therapist, but my degree is in a doctor of physical therapy. And then with that, I have since kind of specialized and grown within my field, as a lot of us tend to do, because in school you really just learn the general, like the basic knowledge of how to treat anything and anybody. But then as you come out of school and, you know, you're wanting to figure out, what am I going to do with my career? You know, do I want to do orthopedics? Do I want to do pediatrics? Do I want to do geriatrics or older adults? Neuro, there's so many different avenues you can go. And that's something I really I feel didn't find until I became a mom.
Wow.
And that's, I think, probably a lot of us go through that when we hit big milestones in our lives, like maybe getting married or moving or getting a new job. And for me, my big milestone was becoming a mom. And we just had a lot of challenges with everything that comes with that for being a parent, especially for the first time. And that's something that I found within that community of physical therapy or therapists in general is actually a specialty in lactation. So that's kind of like, okay, once we made it through our fog period and we were kind of on the other side of some of those challenges, that I just kind of looked into it a little bit more and honestly got some good connections, got some good training, some excellent mentorship that I still do, that I love. And I recently actually completed my certified breastfeeding specialist certification. So all that does is it just kind of allows me to hopefully give some more lactation support with families. And so kind of long story short now is I specifically work with infants. My main focus and passion is from 0 to 5 months. So really like that early period when we're all trying to figure things out, get a good foundation, get established in feeding. That's what I focus on, is I help babies to feed well, move well, feel well, so that hopefully everybody's happy in those early months.
Yes, I love that. I think that so many of the mothers that come into the wellness shop, their motherhood is what kicked off like their non-toxic journey and wanting to do things a little bit differently than maybe they've been taught or anything. So love that was part of your journey.
It's a really good catalyst to good things.
Yeah, hopefully. And that's what I know. I've had other moms who are like, how did you get into this? Or other therapists too, because you know, we've all, I think with my age now, we all have at least one kiddo in our house now. And so when I kind of tell them my story, they're like, man, I hate that you went through that, but I'm so glad that it led to your passion now. And hopefully my goal is really to try to help to either avoid some of those experiences that I went through and my daughter went through, or to be able to address them and resolve them sooner than we were able to.
Can you tell us more about the challenges that you went through?
Yeah, so and being in already like a healthcare field, I really thought I did a lot of research. Like I did several prenatal classes, like read up on things, and I think for like prenatally, I felt like I did a lot. Like I did a non-toxic journey too. Like I've always tried to be fairly clean, but definitely like pregnancy really was like, oh, I really want to buckle down and figure
Watch
out
what goes inside.
Yeah, and like cleaning products is another thing. so kind of, I felt like I prepared for that, but I didn't prepare for like, okay, well, what happens if you get induced? What happens if you have an epidural? What happens when your milk doesn't come in and for days on end and you're like, I don't know, is it coming? Is it not coming? So I don't feel like I did as much preparation for maybe some potential things that honestly happen a lot, especially if we are delivering in a hospital setting. And sometimes even if like that's not our plan, like a lot of things that happened in my postpartum experience was not part of my birth plan. It's just kind of things happen, but then I didn't know really how to deal with them once they had happened. So that was something like, we had an induction that led to an epidural, relatively fast labor after that. And then, I had a sleepy baby who wasn't latching well, feeding well, and again, like a milk supply was questionable type of thing. And so with that too, it's just like a lot of pain, a lot of swelling for myself, and it's just kind of like, it just all got very, very
in a
hard,
really
very
vulnerable
fast.
time too.
Right.
Yeah.
Which like my hormones are just like crazy, and
Yeah.
I'm crying at anything, So yeah, I still sometimes, I'm surprised I'm not crying right now. A lot of times when I tell my story, like I do get emotional because I think I have birth trauma that I still haven't really worked through, because it's kind of like, again, like I have this human now that I have to take care of, and I just kind of some of that couldn't deal with. And so I just kind of have pushed that aside. But I have fortunately like been able to talk about it a little more and like have some providers who have helped walk me through it and be like, based on this, this, and this, like it did make sense for this to happen. It was the safest option for you at that time, which kind of gives me some peace, because sometimes you're like, at the time I didn't really know why I was induced, I think. It was kind of just like, okay, yes, I don't know what else to do. So kind of hearing on the other side of like, oh no, there were some medical indications of like, it probably was a better option. I think I just wish I would have known what the implications are for inductions, are for epidurals, are for antibiotic use and all these other things on like milk supply, on latching, how your baby's going to do with that and how you're going to do with that too. Awesome. So that's something I hope to kind of do some more educating on, and just like share more information to where it's not like it's bad that those things happen, but I think just knowing, so that way you're not like, I don't know, did I do something wrong, or is it just me, like I just can't do this, when a lot of times it's not. It's just like you had a lot of things kind of like challenging and working against you almost, but knowing that you can overcome it with certain interventions or other things that help kind of address that.
It's a huge part of it. So let me ask you this. If you were your patient, what is kind of your, like, how would you approach that as a patient? Like your kind of thought process and philosophy with your clients and patients.
So maybe they had an induction, a fast birth, and their baby seems uncomfortable. What would you be looking at?
So I think for me, I always try to like, let's just take a step back. Let's go back and what happened in the beginning, like, because so much too of what happened in the beginning is going to tell us how we're doing now and how we're going to potentially do in a few weeks from now. So gestational age has a lot to do with it. Like for myself, my daughter, she was full term, which is technically 40 weeks. We do consider anything from, I want to say it's 37 weeks and above is full term, but knowing that really babies' reflexes aren't fully developed until 40, 41, even 42 weeks. So if I have a baby that comes in, they're born at 38 weeks or 37 weeks full term, I know in my head, okay, their reflexes aren't necessarily all the way there yet. They're still developing, they're still emerging. But parents probably don't know that, and nobody really thought probably to tell them, because they have so many other things to think about too. Like they're just trying also to make sure that you're alive and healthy. Not that, oh, by the way, your baby suck reflexes and suck pads have not fully developed yet, so that might make feeding a little more challenging. So just kind of knowing like, okay, how old is baby first of all? And then two, what interventions did we have, because that is going to make a difference, especially if mom needed like a lot of IV fluid, we're going to be very engorged. That's usually much harder for baby to latch onto anyways.
Because the breast will be too firm.
Right.
Okay.
If you think about, because when we're latching on, or when baby's latching on, they're supposed to be taking in a large amount of breast tissue, not just the nipple. So if the breast is so firm that baby can only latch onto the nipple, typically that's uncomfortable for mom or feeding parent. And then two, that's also not very efficient because that's not how our milk is ejected or pulled necessarily, if we're just kind of on the end essentially, only getting that nipple tissue. So kind of like thinking about that, because again, like mom may not know, especially if it's first time, like what engorgement is even, like if that's typical, not typical. So again, kind of looking at some things there, and two, you know, what medications did we take too, because that can also have an impact on if baby's maybe kind of drowsy or sleepy and they're just not awake enough or alert enough to be able to feed great at first. So kind of like looking birth history, my intake information for my families is pretty long, but I try to make it like check bubbles and things to make it go fast. But that is really important to know really everything. And like, you know, did mom have any complications? Was there any complications for baby? Was there a NICU stay involved? Is there jaundice? Is there low blood sugar? Because all of those things can have some type of impact on how we're going to be functioning just on a basic level, like how we're sleeping, how we're feeding, how we're just moving and breathing type of thing. So I think kind of like going back to the basics, and then really just like assessing, okay, what have we been doing now? Like, what are we working on? What is baby good at, first of all? Because so many times we focus on like what we're not good at. And I think as a parent, that's so hard to hear. Like, you don't want to hear that your child's not doing well at anything, right? Like, they're all amazing and perfect.
A++ all the time.
So I think noting to parents, okay, I see baby's really doing well at this, this, and this, and maybe we could use some support at this, and this level or something like that. Trying to reframe it to where it doesn't sound like it's anybody's fault, because it's not. It's just happened. We're just humans.
I had one person in like a breastfeeding group that one time said, you just have to remember this baby doesn't know anything about anything, and especially a first-time mom, it's like, honey, also you don't know anything about anything. You can, you know, like you said, you can have everybody telling you this, 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 and this, but we literally are starting with a clean slate, and they're learning when they know nothing about this outside world. So,
and I find that a lot of peers don't have the support from the older generation, their mothers, aunts. So they maybe didn't breastfeed or aren't familiar with what the best resources are. So it's awesome to have true good facts for people that are going through difficulty.
Or it's a bunch of horror stories of what didn't work. It's like, oh gosh, I'm not going to be able to do this.
So how does your physical therapy background come into play? Like, if is there some sort of manual techniques that you can use to help?
Yes, so probably that's one of my favorite things. And as a physical therapist, like, education is, I would say, at the forefront of what we do. Like, I am always educating and teaching families, or if it was an adult, my patient or client, what it is I'm doing and how they can continue to do it on their own. Because for me, my goal, especially because I only see infants for a short period of time, it's like they're not going to come to me for the rest of their life, and I don't want them to. My goal is to address the reason why they came to me, and then to give them the skills that they need to continue to work on that on their own. And if issues come up in the future, how do you handle them? So I think education is number one, but with that, teaching families like how to hold their baby, how to position their baby. I love infant massage, is probably my favorite. There's so much good research on especially preemie babies and NICU babies, because it's in a controlled setting, so that's how research happens. But it is not necessarily the benefits stop at like, okay, baby's now 40 weeks or a month old, you know, those benefits go away. Anybody can benefit, and I think we know benefits for massage for adults too, so it's like, why would I stop, you know, just because they're not in a hospital, just because maybe they're full term, maybe they're considered healthy overall, that doesn't mean that they can't benefit from something that feels good.
I mean, I imagine they've been cramped in this tiny little sack, and now they have to come out in this world and stretch out, and they need I
when
bet
you're
a
used to
massage.
being
Yeah,
held all the like 24/7, and then it's like, wait a minute, where did that go?
And so I think too, like just helping baby like adjust to gravity first of all, because they haven't experienced that, and two, like knowing like again what is safe to do with baby, because I know as a first-time parent, again, even with physical therapy, even when I'm working with kiddos, I was still like afraid to move her. But it's like they're not fragile. But I think parents can be more comfortable in knowing like, okay, you can support them here, you can help move their shoulders, you can help to move their pelvis, their legs, and just like slowly kind of help them unwind. We're never forcing anything. Obviously reading baby's body language and cues is huge in everything that I do, but I think just showing families like how to help their infant when they need it, or even like when they're just chilling and they're like, oh, I'm just gonna massage your little cheeks or your cute little sweet arms and shoulders and hands. Like it's such a bonding moment.
It's gonna
too.
make me cry because it's like pure connection, you know. And like so often I feel like in this day and age, like so many people or our culture has taught like, put your baby in the chair, and there's a time and a place for that, you know, of course, but it's like
it's a nice way to bond too that isn't necessarily feeding. I know a lot of parents feel like if I don't give the baby a bottle, then I'm not able to bond with them, but that may not be the case. Why don't you try something a little different? That's really neat. Yes.
That's my favorite thing. Skin to skin, I think, if anybody takes away anything from this, skin to skin is the number one thing you can do to help your baby or another baby. Just again, like even if they're not, I would say struggling, quote unquote, but just to be like receive that co-regulation, because we are all born as co-regulators and we learn independent regulation through that co-regulation.
Wow.
And so if we don't maybe have as many opportunities to co-regulate with another person that is seemingly balanced, or you know has that foundation level, it's gonna be hard for us because they know nothing, right? And that blank slate, and that's really hard, I think, too, sometimes for me to understand. Is like, this baby is not like doing this on purpose, right? They're not crying for no reason. I don't believe in that. There's always a reason. But sometimes it's really hard to figure that out.
Yeah.
So if you have a baby that is crying all the time, always upset, what's their first sign that there's something that is physically making them uncomfortable? Do you go to like, oh, it's the tummy drops, you need something for the gas, or is there ever a sign that says like, no, maybe they're jammed or something, you know, like shoulder, out of whack. How can you tell the difference? Or can you?
That, I think it has to come with, again, like that specialty skill set. Like I mentioned, you know, we come out of school as therapists, like with a very baseline knowledge of how to, one, keep people safe, and then two, try to like generally progress them in the right direction. But we are not trained on like specifically like reflux, colic, you know, food allergies or sensitivities, those types of things. Like that is not something that we learn. So that's something I really love to learn about, and I could talk about all day. But knowing like, okay, this baby has signs of tension is a word thrown around a lot and that I use, but you know, are we seeing like redness and creasing in the neck is a common one that generally is not fading within the first few weeks of life, like it's persistent. A lot of times along with that, you know, baby's gonna maybe be postured in a little bit of a tilt or maybe a head turn preference one way, and then they've got that deeper redness or creasing on one side. Along with that too, we can start to see some changes at our pelvis and our trunk. You know, we kind of have like a little banana type of shape, like they kind of bend to one side more, they favor one side. So those are kind of generally some tension signs that I might be looking for. And then of course, again, being a physical therapist, I'm very hands-on, and so I am like tilting, moving baby gently, assessing mobility, flexibility, strength, things like that to kind of see like, okay, what muscles and tissues are firing and moving well, and maybe which ones are not, and how are we going to work on those. But generally, okay, if I'm looking And I'm feeling, because there is something to be said about like feeling joint restrictions or tissue restrictions, knowing like what's a firm type of restriction or maybe like a bony restriction that you're not going to change, and what's maybe more soft, that is more tissue or flexibility or something like that, that I can make a difference on. So knowing kind of and feeling like, okay, is this a baseline typical, like all babies have tension, right? You mentioned, they're crammed up for 9+ months. But is this, again, been persisting or it's getting worse? And so based on kind of how baby's looking and feeling there, definitely too, like looking at abdomen, like is our abdomen rock solid? It's not typical. Then I'm definitely thinking like, okay, are we taking in a bunch of air when we're eating? And that's causing abdominal distension. Or are we not pooping regularly? That's another one, I'm sure, in y'all's world too. Like you talk about how we should all be having regular bowel movements. Same for babies. And I know there are providers and different healthcare workers that, will say, okay, it's okay for a baby not to poop for up to like a week. But I'm like, I would not feel good if I did not poop for up to a week. So I don't know why we think this small human is
We
okay
like
to do
say common, but not normal.
Yes,
we say that a lot around here.
Unfortunately,
So true. So that's something too. It's like, how's our stooling going? Are we regular? Are we not regular? And so then kind of like when you start to find it and peel away some layers, you're like, okay, this is not just what I would call like musculoskeletal, like a tissue issue essentially. It's something more like GI related, or like food protein sensitivity. We have moms or parents that have done elimination diets and things like that. So that is something that I do help families kind of like explore potentially if they want to. I'm never going to tell anybody you have to do this, but I think it's worth giving the information to it and letting families decide what to do with it, essentially. I don't think it's right for us to withhold information that could maybe potentially help your baby feel good, especially if you've been trying a bunch of other things and nothing's worked yet.
Absolutely.
So yeah, kind of knowing like also what have they done already, and then maybe we need to explore some other interventions or avenues.
So what type of patients are coming to you most? Like when parents are calling you, what are they looking for?
Usually they're coming to me after they've seen other people.
Okay.
And it's like, it wasn't a
So you're
quick
like a
fix.
last ditch effort.
Yeah,
Like,
kind of.
Okay.
I would like to not be.
You're like, call me first, guys.
I would like to maybe be, within the 1 to 2. But sometimes it is later because, again, it's like, okay, it's not a quick fix. Like, it wasn't just a body tension issue. It wasn't just an air swallowing issue. It wasn't just a tongue tie. And almost hardly ever, well, and of course that depends on who the clients that are coming to me, but almost always there's a multi-factor reason for baby symptoms or mom symptoms or parent symptoms, why things are the way they are. And so that's what, if we're only addressing one of those, chances are there's probably at least 2 or 3 other things going on that if they don't get addressed too, we don't get a full resolution. And then parents wondering, it's like, well, why didn't this work? I thought this was a problem. So kind of long story short, I forgot where I was going with that.
So do you find people are coming to you like maybe after tongue tie revision or after they've already seen?
Right, another provider. So yes, I feel like that is changing more now because I have had families come to me for the reason of, I want to avoid a tongue tie release.
Okay.
Which I'm not against. But I try to be an unbiased opinion because I get nothing out of your child having a release procedure. There is no financial gain in me for you to have one or for you to not have one, really. Most of the time you're going to see me either way. So, but sometimes it is, we did have the release and it didn't fix our problem. Or it helped a little bit, but it didn't fix everything. And so that's why I like what's still going on. And it also, I think, depends on like what type of release are we talking about. And there's been so much going on in the oral tie, tethered oral tissue world, that I think it's hard for families to know who to listen to or what to believe. And so that's what, again, like, I'm giving you the education and training that I have, and I want you to make the decision that you feel is right for your child and for yourself. Because we know with release procedures now, there's a difference between a provider, maybe at like a pediatrician's office or something, or in the hospital. They do a scissor release where it's more superficial, and we're not getting down to that muscle layer of tissue. And with that, like, you don't need to do any oral stretches or active wound management or anything like that, because you didn't go deep enough.
Right.
That is very different than a release provider like a pediatric dentist or an ENT who's maybe using a laser and is going through multiple layers of tissue and creating like an actual wound in order to get the complete release that is probably warranted to have that full resolution of symptoms. So you've got two different wounds, technically, one that does need active wound management, or some people call it wound care, but we're really not doing anything to the wound. We're just trying to help it heal appropriately, versus, like, again, just a very superficial layer snip, clip, that's not going to need a lot of aftercare. But in my therapy knowledge and world, we have to understand that the tongue is a muscle. It's made up of lots of muscles and surrounded by even more muscles. And just because we release it one way or the other does not mean our body's automatically going to know what to do with that new mobility that we just had or received. And so that's another reason why families come to me. It's because, like, baby's got the mobility, but they don't know what to do with it. They don't know how to use that mobility. And so that's something, like, working on in our field, we call it neuromuscular reeducation. It's like reteaching our brain and that body connection how to function and to move appropriately or optimally, I should say.
Wow. And really getting it young while you can make those connections. Because I know I went through that probably with all three of them, but I didn't know what was going on until my second one. I was familiar with the tongue tie and all of that, and I didn't want to do a surgery, and I was like, I'm just gonna, we fought through, you know, we really overcompensated for the most part. And then by the time I had my third one, I was like, all right, I'm not gonna fight this time. And so I did the scissors.
Okay.
And like you're saying, it's not enough. He still has a small palate. He still has all these things. Whereas my middle one had to have surgery to release everything as a young child. I think it was last year. I think he was 7 years old whenever we finally had it surgically cut and have all the oral tissue released. And we had to do myofunctional therapy before the doctor would agree to do it, because you had to be able to hold your tongue at a certain spot. So we had done like 12 weeks of preparation for the surgery, and then post-op as well. It just learn how to use the tongue and keep it stretchy and everything. But realizing, like, doing the little snip, it helped us then, but it didn't get to the root because the tongue still wasn't able to widen that palate naturally. And so now we're running into, more.
Plus, 7-year-olds have a lot of opinions that maybe babies don't.
So it's interesting hearing you talk about, the different methods and everything, and how it incomplete may not really solve the problem down the line.
And that's so tricky. And again, I never tell families, like, there's a guarantee that this is gonna work, because I can't.
Really can't.
And nobody really should be saying that. Hopefully nobody is. But it is, like, that's why I think as therapists, if I can get a client at a young age, I have the best chance of seeing if we can potentially compensate and the body can kind of work around it, because their brain is so amazing and moldable and just learning and making all these new connections. So I have the best chance of potentially maybe avoiding something like that at that young age. As they get older, 7, 8, 9, 10, like, their body has been used to using their tongue that way for years. It is going to be way more challenging, weeks, months, years, to figure out how to learn and use it differently than an infant that's just been doing it for a few months, maybe.
Yeah, and even as an adult trying to relearn how to
my
properly
gosh,
use your tongue, it's not automatic at all, and I wish it was. I wish I would have had that experience as a child. I was a thumb sucker, a finger sucker, and so I had my tongue was not doing the things that it needed to do. But yeah, I mean, it's amazing to see how important it all works together.
Yeah, and so that's what I really just want to be able to give families options. Like, here's your options with the release, without the release. And sometimes too it can be tricky because baby can present like potentially like they have a tongue tie, a lip tie, whatever. But then we work on things, we work on body tension, we work on just like baby learning how to breathe, open up their rib cage, open up their diaphragm, work on some nasal breathing and things like that. Maybe we're addressing too some like food protein reaction type things, and then our issues resolve.
So you mentioned nasal breathing. I read an article about how native cultures would press their babies' mouths closed often, so that way they would breathe through their nose. It was very common to snip baby's mouth closed. Is that how you encourage nasal breathing? I'm just curious, like, how do you do that?
That's a good question. I definitely don't recommend that.
Yeah, no, okay.
Don't
do that.
Ancient practice.
We don't know for sure that baby can breathe through their nose, potentially.
Okay.
So, like, what if we have a deviated septum? What if we have a cleft or something? Like, what if structurally there's a reason that baby has to breathe through their mouth? So that's why I don't want to take away their only airway, because that's dangerous.
Yeah.
But that would be something like assessing for, okay, if maybe I do encourage a closed mouth posture, oral resting posture, what does baby do? Do they like start to panic? Do their eyes get big? Do they start to get red or blue or start flailing around? Okay, well then that's telling me we probably need a referral to an ENT
Structurally
to see like what's going on. There's a reason why baby cannot physically breathe through their nose. So if I know for sure, like baby's comfortable breathing through their nose, they just don't know how to do it, then that's something we can work on teaching that muscle. Like in myofunctional therapy, I'm not a myofunctional therapist. That's usually something for kiddos who are ages 4 and up. They have to be able to follow directions and cues and things like that more. But for me, it goes back to, again, that neuromuscular reeducation. Like I'm teaching, where does the tongue need to live? It needs to live in our palate. And so there's different activities and techniques, and also teaching families about the tools that they're using. So what does our pacifier usage look like? If we always have a pacifier in our mouth, how can we ever get our tongue to our palate? You know, so just like teaching, like knowing that pacifiers, I do use them in my practice, but I use them with a certain purpose and a reason, and then when we're done with that, then, you know, we're transitioning away, because we shouldn't always have something in our mouth. So kind of teaching like families about the tools that they use and how to use them more in a therapeutic manner. Versus, and I did this too as a mom, like I go back and look at pictures of my daughter, and she was like wide awake, happy, and had a pacifier in her mouth, and I'm like, she didn't need it. But it was just like, it's just what you see people do, I think. You're like, oh,
babies need a pacifier. They just put it in, and they don't make noise. It's nice.
And so I think teaching us like when to use a pacifier, when you don't need to use a pacifier, those types of things. There's also, you know, something I think to be said with like what, if we are using bottles, like what type of bottle system are we using? You know, just kind of like when baby is not talking or babbling or eating or crying or things like that, like what are they doing? What does their mouth look like? What does their body look like? And then seeing how can we make changes, progressing towards the goals that we want to achieve ultimately.
Cool. So I know I read in your bio that you help babies with torticollis.
Yes.
And that, from my understanding, is like a twist in the neck.
So it's technically, I think it translates to like wry neck, technically. Typical presentation, it kind of goes back to what I had mentioned earlier. They had like this head tilt, and typically it's a head tilt to one side and a rotation to the other side. It's typical presentation. You can get a head tilt and a rotation to the same side. It just kind of depends on which muscles are affected and kind of the line of pull in the spine that's going on.
And is this something you would notice in a newborn baby?
You can, and that's something that's like, I really don't want to just go by like a picture. Like I'm never going to tell somebody, oh, yep, they have torticollis based on a picture you tell me, because that's just one snapshot in time. So that's really assessing and feeling like, okay, what is their lateral neck flexion like? What is their rotation like? Their extension, their flexion? How are all of those motions, and how are they not just like what is the quantity of that motion, like how far can they go, but also what is the quality? Like, is their trunk also rotating when I rotate their neck? Or do we have nice segmented movement here? So I think having to, again, be able to get your hands on a baby. So in all my sessions, like part of it is an observation period, and then part of it is like a physical assessment period as well, if baby is okay with that. Of course, sometimes they gotta be in the right mood for that. And so a lot of times too, we may not get through everything in one session, but always, I have a good idea of like what we need to start with, and then each session we do, we're building on that and progressing. We're not just going to be doing the same thing every time. That's not going to help us improve or continue to progress and meet our goals. So torticollis is a big one, but I think sometimes that can kind of be like overdiagnosed just because baby happens to like maybe prefer one position, but they don't necessarily have a restriction there. It's just like a postural preference type of thing. And so in that case, like we're then kind of teaching baby, hey, you have this whole other side of your body that you can explore too. And so we're just kind of like reorienting them to the other half, kind of.
That's really neat.
So we have been fortunate enough to have you at the birth workers meetup at the shop every first Saturday of the month.
Yes.
At the Wellness shop. But we want to get you connected to the community, so maybe you're not the down the line. Maybe you're more of a frontline worker. Yeah, we love that. So where can community members find you? Do you have a website? Do you have social media? Do you do all that?
I have both. I'm not super tech savvy, so still working on those things. But yes, I have a website, and that lists all of my services. I do have different options. I do in-home visits for newborns, actually.
Oh, that's gotta be nice.
Because I know how hard it is.
Who wants to
get
leave your
out.
house? Yeah, you're like, I'm leaking, I'm crying, please just come to me.
So that's what I have been asked, and actually part of the reason too, at the birth worker meetup, I did have those moms there ask me about it as well, and so I finally was like, okay, I will do it for my newborns because I know how hard it is to get out of the house. So that is an option if families want to have that in-home option. If not, I do have a clinic space that I rent room from. The therapist is Dr. Lonnie, but she owns Essentials Pelvic Therapy and Wellness.
We love her.
Yeah, so she has been so kind and amazing, and I rent a room from her. Awesome. We share a room together. So that's in downtown Springdale. And then my third way that I can work with clients is virtually. So maybe they're not able to do in-home, they live, farther away, or in Central Arkansas or a different state even. And so that's what I can do, virtual visits to. And I love those because they can kind of just be like, maybe you just want some tips, tricks, or just something to get you going. Maybe it's nothing going wrong necessarily, but you just want to learn more about your baby. So a virtual option, I think, is great.
That's great.
Great for that, just to kind of learn, my baby's not really loving tummy time. What can I do?
Right. Yeah.
So those are kind of 3 different ways that I can work with families and their littles.
So what can you do if baby doesn't like tummy time? Is there a...
It depends. Again, it's why don't we like tummy time? A lot of time that goes back to they're uncomfortable being on their stomach. And so then we're trying to figure out why is that. Is that because we do have like some underlying torticollis that's pulling our body down? So if I'm on my stomach, it's going to be really hard for me to push up because that's pulling against tension that my body has, and it's uncomfortable. If you've stretched, like my hamstrings are so tight, when I stretch them to my end range, like it's not comfortable. And so if you think of that, what a baby's feeling, it's like, why would they ever make themselves feel uncomfortable?
Right, yeah.
You know, and so of course they're not going to want to do it, so they're going to cry, and then we're going to get them out of it, but then we're never going to progress in that manner. So trying to figure out, like, is that a reason? Is it because our tummy's uncomfortable because we do have like GI stuff going on, or we have a lot of gas issues or things like that? So kind of coming back to what is the reason, and then from there we're gonna help improve tummy time by addressing why do we dislike tummy time in the first place.
That is so neat. So remind us again, what's your website?
Yes. So my business name is Latch and Bloom Infant Therapy, and my website is just latchandbloomtherapy.com. You can also find me Instagram, it's Latch and Bloom Therapy, and then Facebook, Latch and Bloom Infant Therapy too.
Awesome.
Love that name.
Yes.
Thank you. Yeah.
We are so appreciative of all the tips. I'm so grateful to have this podcast as part of our resource library, because maybe we'll have some parents come in and be like, I'm dealing with this. We can tell them, go listen to this episode. You're going to get so much great information.
I love it.
And then they'll be
then
able
go to
to
her website.
contact you and work a little harder, work a little further and more detailed with you. I really appreciate you coming out.
Absolutely. Thank you guys so much for having me. It's been fun. Again, I could talk about this stuff all day. So
Yeah.
I enjoy it. Anytime
I could
get
sense a
to.
part 2 coming.
Yes.
This was so
I hope so.
informative. Is there anything else you want to share with the listeners?
I mean, I think my big thing is just like to be curious and ask questions, and to know if, I think for me, one reason my daughter and I eventually, I think we're able to get to a good spot is because I kept pushing and I knew something was wrong. I didn't know what was wrong, but I knew something was wrong, and I kept pushing until I found the people that could help us. And so I just encourage anybody who, you know, maybe is kind of in the thick of it right now to know that, like, there's nothing wrong with their child. There's nothing wrong with you. We just need some support, and we got to figure out what it is. So I just encourage anybody to keep searching to find your people, so you can get answers, because no baby should just be unhappy and
Yes.
feel that way.
So glad we have this community to be so supportive, and we're grateful for great insight and information.
Yeah, absolutely. Well, thank you guys so much.
Thank you so
Thank
much.
you. Thanks, guys.
everybody.
Bye.